All right, Dr. Emer, we're live.
Hey guys, it's Dr. Emer, and I'm excited today to do a little male facial sculpting. We have a great looking client of mine who does maintenance treatments. He looks very young because we keep him looking that way. He likes a sculpted look, he likes a tighter look to the face and likes some definition. He has a facial structure where this area of the face starts to come down a little bit earlier in life and pushes not only to create folds, but this sort of like indentation that's right here. So a lot of times we'll use fillers to give a little support and nothing too lateral, otherwise it makes him look a little more feminine. Also defining out sort of the chin and jawline area, so we may work to just do a little bit to his chin here, but overall his profile looks really good in terms of lip, chin, nose ratio. I love it. And his rhinoplasty is coming in really phenomenal. It's like actually changing dramatically.
You can't even tell. Look, no scar.
No scars at all, which is amazing because it was an open approach. Revision case, which is more difficult. And the cool thing is, as your nose, as you go further and further along, the nose shrinks and tightens up. So it gets a little more defined. So even when I didn't see him in maybe like 2 months, it's significantly improved. So we're gonna use radius first in the structural areas of the face. So I'm gonna start a little bit in this mid-face area, just to give a little bit of mid-facial support. I want him to have a little more sculpting.
Good boy saying hello from Florida.
Hey guys, you better come see us then in Boca. We've been on fire with our Boca patients lately. They've been getting such good results. It's crazy. Now with him I go a little bit more lateral.
Dr. Hellman's on here too with us.
Dr. Hellman, we're going to see you in a few weeks in New York. Can't wait. So you guys see with just that little strut did, that horizontal vector allows the medial fat pad to meet with the lateral fat pad to give a more squared off look. Switch sides, hold there. So we're going to do the same thing on the other side. We love Dr. Hellman. She's one of my teachers when I was a resident. So again, this area here tends to give a little, you know, a softer appearance to the face. It also makes the mid-face kind of fall slightly.
Someone just moved from LA to Fort Lauderdale. You guys are very close by us.
Perfect.
Come see us in Boca.
That'd be great. So again, working more of that horizontal, not going too lateral. Good. And then go ahead and hold right here. No, you're good, you're good.
Do you have access to all the same procedures in Boca as California? Yes, we do. Aside from the body sculpting, we will offer that very soon in Boca.
The only thing we haven't been doing in Boca right now is tattoo removal, which we probably will be doing by the end of the year. But everything else we do, all the laser combinations, filler, Botox, lasers, threads. So now we're going to work a little bit on folds and chin. And he doesn't need too much of the fold, but this piriform aperture, what were you saying?
They want about your thoughts on going to Colorado.
Would love, actually, I'm licensed there, you guys, because I originally thought I wanted to go there. But our next step, and I don't want to get people too excited yet, is probably going to be Texas. So don't get too crazy, but that's probably where it's going to be.
Someone from Florida wants to come here for Gladiator. Yes, guys, come here. The aftercare is like no other here, and it's very important.
And we do it in New York, so straightforward cases, you can tell them we can do in New York. We do have some aftercare in New York, it's just not as aggressive. So some of the more aggressive procedures with implants,
revision
lipo,
lipo,
or revisions, oh, that looks really good. Then we probably want to.
We're going to ask you to come here.
Come here, exactly. So there's a vessel that comes across here called the superficial transverse facial. It's very frequently hit the vein when you do the lateral cheek. So just FYI, if you hold a lot of pressure there, the chance of bruising goes down.
Someone wants to know, do you ever have concerns of the artery when injecting in the chin?
Not really. The chin artery, remember, is more lateral. Along here, we're focused on here. So we're on bone, should be pretty good in terms of safety.
Someone just emailed us. Thank you very much. We'll be in contact with you.
Awesome.
And again, they're asking about aspirating.
Aspiration, you guys, if you read the literature, it shows no effect does not help you at all. And I've been saying that for close to 12 years. Yet, everyone criticized me, and then a new article came out last year basically saying that aspiration does not help you, unfortunately.
So wants to know, do you recommend PDO threads to help with under eye hollows?
Not for hollowing there, but for lifting the fat pads below. It gives a little bit of shaping. It gives a little bit of camouflage.
Someone says, gorgeous, love the lips.
Everyone loves his lips. Every time we do it, they tend to, he gets a slew of people wanting to make out. But he's taken. You can still send in offerings. So I always do just a little bit in this crease here, makes the lower lip evert slightly, and it also gives more of a blended look. If you don't do this, it tends to make hollowing through here that looks more old, because our face tends to sag a little bit and droop as we get older, but also the mouth, I'm going to tilt you back a sec.
What filler are you using?
Tends to cave in. What filler we're using is Kiss. This is for people that want a little more voluptuous of a lip, a little more volume and shaping. Kiss is really good. And again, same thing in this, we call this the lower cutaneous lip, which is through here. Now, do you have to be careful with vessels here? You do, because there's inferior labial arteries that come through here. But again, remember, I did Mohs surgery, so I know the planes. I'm gonna do a little bit up here. He's a pro. Good, let me take a look in the front now. So you guys see now we were able to fill in that gap that was right here. I do want to sometimes be careful with a little bit of...
What causes fillers to break down over time? Is it sweat, metabolism, or heat?
Well, it's really a mix of things, but it's probably your metabolism and your body enzymes. That's perfect, that's soft, that's good. Last little bit. So
How many milliliters are you using in his face in total?
So right now we're using, let me think about this. 2, 3, 4, 5. No, 4.
If you guys watch the video from the beginning, you can count.
4 cc's, you guys. 4 cc's to treat mid-face, lateral cheek, folds, chin, and lip. Okay, so let's give him the mirror. Okay.
Give him the phone.
No, give him the phone first. He'll hold the mirror. We're gonna do an Emer reveal because he's always memorized. It's amazing. I feel like since I've known you, haven't aged. You've aged backwards. Okay, a phone.
All right.
Take the phone
There
first.
you go. Grab the
I
phone.
like you looking at this angle. Hold it up a little bit so you can see the structure. So here's the thing: softening through here, a little lift. Hold here, and I widen this slightly, and then the lips, which are more maintenance at this point. What do you think?
Love it. Yay.
Looks great. So now show everyone on the mirror because it looks different. You look great. Looks really good. What do you think? In the back gallery, how do you think he looks? Thumbs up from the back. Excellent.
Good.
Good.
Hey.
Perfect. So softening through here and lifted, softening through here. And
Someone
here.
wants to know about speaking Spanish. We do. We have Spanish speaking
I
here
don't
in,
know
the,
how
in,
to
our
speak it,
in our
but-
concierge center. We do.
Oh, just someone speaks
Yeah.
Spanish? Yes, we have many people that do. I don't, unfortunately. My boyfriend will be really mad at me because he wants me to learn it, but I will eventually. So now pan and show his face because he looks really, really good. And that's it. Successful male facial sculpting, you guys. Another great case. Really good.
All right.
Awesome.
I kind of want my nose done now.
It is.